My name is John Bourke. I'm a consultant cardiologist based at the Tyne Hospital in Newcastle on Tyne. So what I want to talk to you about today is the effect that Duchenne muscular dystrophy has on the heart. In Duchenne muscular dystrophy, the heart is uniquely vulnerable to damage on a day-to-day basis with excessive need for repair. So it's best to think about the heart as being built like a stack of cards in Duchenne dystrophy. It weakens over time in everyone with Duchenne, although there's some variability about the age at which this begins and is detectable. Symptoms have nothing to do with this. The heart would need to be at rock bottom in terms of its pumping function before a patient would be aware of any heart-related symptoms. So to pick up whether the heart is becoming affected and whether the heart is weakening or how it's responding to treatment is only decided on the basis of heart scans and other tests. The most commonly used test is an echocardiogram. That's an ultrasound scan of the heart, which takes about 30 minutes to do, is quite painless, and it gives a whole range of heart functional measurements. And the idea is to compare the results from one assessment to the next one to detect any changes. Increasingly, however, we tend to recommend heart treatments to boys with Duchenne dystrophy no later than age 10. This is because the commonest age, or the average age, for picking up heart weakness is around the age of 13 years. And so starting treatment protectively or prophylactically is actually beneficial in slowing the overall process. When a boy reaches the age of 10, if they're not on treatment already, and even if their heart tests are entirely normal, we tend to start one particular family of drugs called ACE inhibitors. There's a whole range of these, they're very well tolerated, and we tend to prefer a once-a-day medicine. If the heart is abnormally fast, as often is the case in Duchenne dystrophy around this time, then we add a second medicine, a beta blocker, to complement the ACE inhibitor, slow the heart and make it more efficient. And by the time the heart is showing any signs of weakness in terms of its pump action, then a boy would typically be on 3 medicines, the third one being something to block scar formation within the heart itself. So the take-home message is that your heart will become involved at some stage. The treatments which are well tolerated benefit the heart, support it for as long as possible, and need to be started early for their best benefits. So the message I want to leave you with is that be sure you're getting heart checks from an early age, essentially from diagnosis, and that there's a cardiologist involved in your treatment, so that you can get the very best out of the medicines available and have the heart protected for as long as possible in Duchenne dystrophy. Thanks very much for listening.